So how many times have you seen somebody kind of going like this, or even with a cell phone, kind of grabbing the small size of a cell phone and cranking on their neck and talking? I mean, just with a regular phone it's bad enough because of the kind of contracture you have to get into, but with a cell phone even worse. And then carrying something on the other side. The problem I find with a lot of people who work 8 to 10 hours at a computer terminal is that the posture is usually pretty bad. If you see a chiropractor, then you're probably well aware of the posture you're supposed to maintain, but the reason we have elbow rests on seats is to take the pressure off of the shoulders. This is about 10 to 15 pounds of weight depending on how big your guns are, but sometimes that'll add to the work or the burden of the trapezius over the course of time. So it is important to always have your elbows at a rested spot and the wrists at a rested spot. If we had a split keyboard where it was canted a little bit on an incline on each side, that would be ideal. And usually straight on looking would be important. The problem would be if you have another window over here on your left and you have to have somebody talk to you like that. If you're constantly looking at the wrong direction, you're going to be dominant with flexion to one side, which is not normal. And after the course of a year, 2 years, it can add to problems. Or if you have an injury that you had working out or swimming, then you go into a job where you have to have sustained posture for a long amount of time. That injury can last a long time. So the idea is to have an ergonomic evaluation, if your company pays for it, by the human resources or occupational medicine doctors or the occupational medicine therapists. The other problem I commonly see is when people use laptops. Either laptops without any elbow supports in their chairs, or lying down in bed and doing this kind of thing on a small screen where you're kind of looking this way and causing your neck to get into full flexion when it's not supposed to be that for a long amount of time. Having a keyboard that's situated in front of you properly is good. Having your back straight with lumbar support is good. Having the top of the monitor about eye level is also good, so your shoulders and your neck are in neutral spine. This keyboard I have to kind of come over a little bit this way, so it's not exactly centered, and if I do center it, my elbows are no longer supported. So you can see how an ergonomic evaluation would probably be helpful. This desktop monitor adjusts height. This cannot be adjusted, so if you can get a monitor to this level and get a Bluetooth keyboard, it'd be better for you. Usually the Bluetooth keyboards are cheap, better than having a neck problem or trying to maintain the poor posture for a long amount of time. The objective with sustainable change also transfers over not into a healthy anti-inflammatory lifestyle, but also a healthy work environment. And with us spending more time at work than we do at play, it is important to be conscious or mindful about the positions we take and the pain that we go through. So if you do have a challenge space, try to ask your employer for an older computer, maybe a desktop computer versus a laptop, or a Bluetooth keyboard, or even a plug-in USB keyboard that you can connect to your laptop. Just as long as you have a keyboard that's safe, and your wrists and shoulders are safe, and your head is not tilted down all the time. The things I usually suggest for my patients when it comes to shoulder range of motion every once in a while is to take a break. So, I essentially think of the shoulders and the neck as doing two separate things. I have some range of motion shoulder exercises I did on another video. I'll put a link to that. But as far as stretching the neck, there's usually just 4 directions that you can stretch in. There's flexion, where your chin goes down, shoulders go back, chin goes down, and you'll feel a sensation of stretching to the trapezius and the paracervical muscles of the neck. There's also extension, where the chin goes up. Again, shoulders stay back. If you keep your shoulders and chest in a neutral position, bring up the chin. Most people will try to jut their chin in, but if you can maintain that Captain America chin, keep it up, and prognathic like this, you'll feel the stretch to your strap muscles. Then there's a side bend. You have to be careful because if you have a numbness or tingling, side bending can cause problems in this direction and this direction. For more added flexibility, sometimes in yoga I'll have people try to give themselves a little bit of pressure in flexion position, taking a deep breath in, and then gently arching downward. Technically that's not called arching, but pulling downward to the point where you feel good stretching but no pain. And then also with the shoulders back, reaching up, deep breath in, chest out. And you don't want to necessarily just drop your head back. You want to extend the angle so that the top of your head is extending upward and outward. Same thing with flexion. You don't want to just bring the chin down. You want to extend the curve of the spine outward. So flexion, hyperextension. And then for side, I like to neutralize my shoulders. I have to neutralize by sending my arm to my back and then pulling gently while keeping good posture to one side. Deep breath in. As you exhale, you put a little pressure into the curve so that you can feel stretching to the trapezius and a little bit to the levator scapulae of the back. That's this muscle back here. And you do it while holding to a short 1,000, 2, 1,000, 3, 1,000, or you can do the 4-7-8 breath technique, like in the shoulder roll demonstration. You do it to the other side too. Again, as far as where you put the shoulder, if you can keep a neutral spine and a neutral shoulder position in the military position, and then just work on flexibility one side. Deep breath in. Relax, drop the shoulder. Shoulders are notorious. The deltoid and the trapezius are notorious for being tight. I had to reduce a boxer's shoulder that was dislocated once, and it took forever to pull the shoulder because he had huge deltoids and huge trapezius muscles, and it took forever for him to relax. But eventually the shoulders do get to a point where they're flexible. Again, I like to put my arm behind me, and then with a neutral position, try to, as I breathe out, stretch a little bit into the muscle so you can feel good sensation to the point of stretching, and hold it during the breath. Usually that 4-7-8 breath technique would be great there. If you do that for about 5 rounds, forward, backward, side, side, and then 4 more times repeated, you'll have a pretty decent range of motion. Then those of you that are unfortunately going back to work, you get back to work and you maybe do the shoulder whirls. Those of you who I've asked to put into a neck collar because your trapezius spasm is just getting too difficult to manage, whether it's a neck collar, soft neck collar that you're using, or a sling to take the pressure off of the trapezius while we're kind of working with a physical therapist, whatever you do, if you're immobilized, you should get out of those contraptions for a short amount of time, work on range of motion both of neck and shoulders, then get back into whichever preference that you have gone into. It is important when you splint. Splinting, it does help. Hopefully you don't need it for just an ergonomic issue and you just need it for an injury, but splinting is important, but so is the value of stretching the muscle that has been splinted and is contracted while it's in the splint or while it's in the immobilizer. So don't forget, usually use the cryotherapy or the topical pain relief in addition to an anti-inflammatory, whether it's a true prescription anti-inflammatory or something like turmeric, glucosamine sulfate, or SAMe. Either way, if it's critical or if it's painful, you take care of being seen first and then follow my orders. If it's not painful and just working on ergonomic change, try to work on posture, and if you can't get it, then you can ask your doctor for a physical therapy prescription or a visit to a chiropractor. There are some chiropractors that are excellent. There are also some that have to get references for, so ask around first before you go, just like you seeing any other doctor, and hopefully you'll avoid having to come see an orthopedic surgeon or myself in the near future.